diagnosis of cancer can leave you feeling confused, scared, angry, unsure where to go, and more. Words cannot even describe it. Our guest today is Becky Franks. Becky works for the cancer support community of Montana. This can provide local help, guidance, insights, and so much more. You don't want to miss this episode.
And she said, it's interesting how cancer is changing. And if you live in Montana, it's the fly or die state.
Ooh.
I know. And I was like, what? Well, not anymore, my friends, because, and a lot because of the state coalition. The state coalition is so many dedicated people who come together and think about, how do we improve cancer care? Where are the gaps? In this state where there's such few population centers, how do we bring specialties to different parts of the state and then support each other in that to make sure we don't have to go to Washington, we don't have to go to Denver, we don't have to go to Minnesota to get our cancer care. We can get our cancer care right here at home. And from my perspective with the psychosocial care and the mental health of people with cancer, when you can get your treatment at home, you do better. When you've got your dog by your bed, your family around you, you can still go to work, you can still go out in your yard and pick your flowers, you do better.
Absolutely.
And what people don't understand is that the cancer experience is really long. This is not a shoulder surgery. You're in this for the long haul. So all these volunteers got together and made the Montana Cancer Coalition and has made wonderful gains since its inception. I think we're now into our third strategic plan. It's every 5 years. And we're making gains to improve the care all the way across. So there's 7 main cancer centers across Montana. And then there's a lot of infusion centers that help people get their treatment in their community. And there are also services for psychosocial support. So how do you find them? And one of the ways that we did that is we made a map. So it's an interactive map that has all these fancy names that I'm not going to remember. And you can find it on the state coalitions, the Montana Cancer Coalition. So if you just query that in your Google, you'll be able to find the website and then go to the resource maps. And that's one of the sources that we use here at Cancer Support Community. When someone calls and they live in Shelby or they live in Plentywood or whatever, wherever they live in Montana, what's available to them there. You can go on the map and you just hover over it, and then you can see a lot of services that are available. It's not 100% because that's really hard to get 100%, but it's darn close.
That's nice, definitely. And then Becky, I'm wondering, I know a lot of times there's a bell that people ring when they're considered cancer-free after they've gone through those years and months, but I could see where that would be really very weighing. You'd be carrying a big, I don't know, I imagine it like a backpack. Like, I'm a cancer survivor, but oh my gosh, I can't put this thing down because is it going to come back? Is it going to come back worse? Is it going to come back and we don't catch it too soon? How do you go back to or do you go back to living a normal life? Can you talk about that? How you guys might be able to help?
Yeah, I'm so glad you brought that up because what we find is that is probably the loneliest moment of the whole trajectory. Remember when I said that when you first get diagnosed with cancer, everyone's got brownies at your door? When you ring the bell, it's after months of treatment, maybe years of treatment, okay? By that time, your family is over it, right? Your friends are over it. And when you ring the bell, it almost signifies that you're going to go back to normal. What time's dinner? You come back to work?
Mm-hmm. Right. All done. Move on.
Yeah, I'm ready to move on. And when my mom rang the bell, I was totally ready to move on. Like, boy, oh boy, that was just, I'm wringing my hands on that, right? I'm done. That was uncomfortable. I don't want to do that anymore as a caregiver, right? Of course, I know better now. So what does it really mean? We talk about a new normal, and that's a lot what Mending in the Mountains is. And a lot of our programs is about, how do you find your new normal? What does that mean? What does that look like? And it's really important that people are able to get their survivorship services. And that's one of the key components of the state coalition is we've got a group of dedicated people looking at how do we find quality of life in survivorship? How do we help people ring the bell and thrive? How do we help them heal emotionally and physically? When we were talking about physical activity and exercise, one of the things that almost everybody is wrapped with is just a deep, deep fatigue. I'm not a cancer survivor. So when I think of fatigue, I think of the most tired I've ever been times 10. We're talking can't peel yourself off the sofa fatigue, right? But yet you're kind of walking around. You got to figure it out. You got chemo brain. You've got fatigue. How do you get rid of that? You can wait, or you can be active in your recovery and engage and start thinking about healthy nutrition and exercise and going out and doing things in the world and assessing your life and reassessing your life. We have many cancer survivors at that moment in time, and once they understand life is a little short, it's a short for all of us, remember, but once they understand that, I've never liked this job, I need a new one. I've never liked you, I'm getting a new friend. I'm getting a new life. I've always wanted to move to England, I'm moving. It's a new normal. One of the joys of working at Cancer Support Community is that ability to want to jump in and love life is brought to me every single day. And because cancer survivors don't mess around, they are living life. They're enjoying the blue skies. They're taking work off to go hike. And that kind of fresh energy is a gift to be around.
Yeah, that's fantastic. That's a dose that I think we could all use, in all honesty. I mean,
and it's opposite what people think. When they think, well, I don't want to go to Cancer Support Community, that's going to be depressing, all these depressing people, complete opposite. Complete opposite. This is people who will understand you and help you jump into loving life. It really is. Because like I said, cancer survivors don't mess around. They don't have the time. Now they might have the time. Most do have the time. Most will die of old age, right? But they understand that no one's getting out of here alive. And most of us don't. Most of us take that for granted.
absolutely. Very eye-opening, and so much more to it than what, those of us walking around in our average everyday routine don't even consider, don't even think about. And yeah, I'm sitting here thinking, I know a few people in their 40s diagnosed with cancer in this last year. I think I need to send them an email after this and see if they even, did you go to Mending in the Mountains yet?
We actually have a program. It's called Cancer Transitions. And it's a really important program because, again, when people ring that bell, many, many people will just muddle around and not feel quite right. Just don't feel quite right. I thought I'd be back to my life. I don't know how to find my new normal. I don't even know what a new normal is. Am I crazy because I'm not feeling normal? What's this? I can't keep track of my thoughts. Am I crazy? It's like, no, that's chemo brain. I've got all these side effects, but I'm grateful to be alive. So I'm not going to mention them to my doctor, right? So Cancer Transitions, the sooner you can get into that program, the better it is. It's 4 sessions. And it really literally walks you through medical management, understanding all the side effects and which ones we can help you manage. There's a lot of ways to manage the side effects. We don't have to deal with them anymore, right? How do you start exercising? What nutrition is important? How do you manage these feelings of not necessarily like you fit in? How do you figure out what this new normal means? That sets you on a whole trajectory of healing and thriving and doing great. So you can muddle along and wait for years and just hope you get better, or you can jump into Cancer Transitions, which is offered every 2 months here, virtually and in person. And you can get better super fast and start to thrive. And it's free of charge. So how do you find it? Just on our website. You can pick up the phone, give us a call. All the phone numbers, everything's right there. CancerSupportMontana.org. Because most of those things, I see people live with side effects that it's just so painful. It's like, why have you been living with that for 2 years? we could have addressed it and it could be gone by now.
There's a definite choice there, two paths. I'm either going to survive and thrive, or I'm going to continue on.
Yeah, I don't make up many words, but there's one I do make up. It's called the grateful patient syndrome. That's a Becky Franks invented thing. So just for the record, it really is where you get done with cancer treatment and you're so grateful that you're still there and that your hair came back, that you're not going to talk about the pain that you have in your shoulder. You're not going to talk about the sexual health issues that you're experiencing. You're not going to talk about the chemo brain that you're experiencing. You're not going to talk about the sadness that you're experiencing. Every single one of those things that I just mentioned can get better if you just say something. And it's not even that hard to get better. And I can go on the State Coalition map and help you find those services anywhere you live. So there you go. Shabam.
Fantastic. Oh, an example just from my own personal life. I had a colleague whose son faced cancer for many years. And he, rang the bells, cancer free. And it was actually the mother, my colleague, that he would get a cold and get some inflamed lymph nodes. And she wouldn't sleep for days out of fear. It's back. It's back. They'd get him in, biopsy those lymph nodes. Oh, it's just a reaction. Or, oh, it's because he cut his thumb here and it was an infection. Or is there supports for, the caretakers out there?
Absolutely. And that's one of the things that we address a lot is how do you manage that constant anxiety of fear of recurrence? For both the caregiver, and you'll see it on our website, friends and family, because caregiver that term gets to be confusing. But for the friends and family and the patient, that fear of recurrence, there's this term that's really weird. It's called scanxiety. Two things that are interesting. One is when people have had cancer, you'd think that they would be getting their mammogram like every month or wanting to get their mammogram every month, right? Just to see, oh my gosh, is it back? Because it's so, you're so afraid that it's going to come back. And what are you going to do, right? First of all, how do you manage that anxiety? The last time you got a scan, it really sucked. It was horrible, right? Because you got diagnosed with cancer. So don't want to do that again. And so it's so frightening that many cancer survivors don't get screenings. They don't now go get a colonoscopy and they don't go to the dermatologist and get their skin scans anymore because they're almost afraid to get into that place. Not all, but some cancer survivors, they're like they're all in, they're getting all their scans all the time. But for many, they don't get any scans, which is a mistake. You have had that anxiety of reoccurrence. You're not alone. You're not the only one. And so how do you manage it? Just like you manage everything else, you learn ways to deal with it. And that's where being with other cancer survivors and learning how they manage it and really looking at how do you stay mindful in that time and help manage the situation through information and through breathing and through being able to reach up and call somebody. Remember what I told you is that community is stronger than cancer.
Yeah, absolutely. Absolutely. It's funny you mentioned this scanxiety. My career prior to this one, I did ultrasound for, I'm almost 20 years into it now. And we would do that. You've lost your other kidney to cancer and we're scanning you today to see if we can see a mass. We're doing your yearly screening. We would even see it with miscarriages or pregnancy loss, where people would come in and they'd literally be like, can we do this in the other exam room? Because this is the room that it happened in. This is the room where that tumor was found, or this was the room where I found out my 35-week baby didn't have a heartbeat anymore. I can't even walk through those doors, and I would see a lot of good coping. I'd see neighbors. Yeah, my neighbor drove me. He told me it was time. Yeah, he's making me come to this appointment, or people holding hands while you do the exam to just help them get through that. And it is invisible, but massively there out in the world. And so that's I like your term, scanxiety. It's perfect.
And I didn't make that one up. And it's interesting. It's why cancer support community is not at the hospital. And it's why cancer support community is so important. Many of our cancer centers in Montana and across the country have tried hard to hold supportive programs at their cancer center. Support groups, maybe yoga, education works better, but for many cancer survivors, like you just said, as wonderful as our cancer centers are in Montana, and they are fantastic. Everyone, I want you to hear that. And they're warm and they're welcoming. And, I've never heard people rave about another set of people except oncology nurses. Oncology nurses are going straight to heaven, I swear. They are the nicest, kindest, wonderful people. But that's where people get their treatment. And they don't want to go back. So a cancer center puts on all kinds of energy and money to develop all these programs, and then nobody shows up. And they're like, what happened? Why didn't that happen? Well, people don't want to go back to the hospital. They want to go into a place that's warm, welcoming, home-like, with people who understand and find their health and healing and well-being and healthy lifestyle stuff, right? Their way forward. And they'll go back to the hospital for all their scans and to see the doctor who's so reassuring to them, and the nurses and everybody who cared for them so well. But for support, they want to go somewhere else. You guys do the medical, we'll do the psychosocial, and together we're going to be the best care for people in Montana. This is not the fly or die state. This is where you can thrive state in Montana. Yeah.
Very awesome. Yeah. That's interesting. That's something too that even our healthcare systems could think about. You have these wonderful programs, just move them out of the hospital, take them down to the library, take them to the senior center, whatever community building you've got nearby.
And also the ability to partner with Cancer Support Community Montana. This is what we do really well. And I mentioned that we're a national organization, and yet the closest one to the south is Phoenix, Arizona. Closest to the east is Minneapolis. And the closest to the west is either San Francisco or Tokyo, depending on how you draw the line. Because these two women had a vision and a dream and said, we don't want to be alone during this cancer experience. And so our national organization has a research and training institute and has since 1982. So everything we do really well. We understand the research behind the experience of cancer, behind the psychological effects of cancer. We understand the distress. We have distress screening to help people identify issues instead of living with them and being a grateful patient. Instead, saying, hey, I've got something going on and I need to figure out how to manage it. So everything we do is very specific to make sure that people who engage in our programs improve their quality of life at the time of diagnosis and through the cancer experience into survivorship and into end of life, when there are opportunities to be in control of how you die.
I was just going to ask if you guys, if it doesn't take the path of surviving, if it does need to do like hospice and quality end of life care, are you guys able to help connect people, connect families?
Absolutely. Do you remember when I said that when people have cancer, everyone's cheering you on? You can do it. You're going to fight this. You're going to beat this. Sometimes you're not.
Right.
And no one in your family wants to talk about that. Right. And so we're the people who openly talk about death and dying. And we're not throwing pity at it, but we can talk about, how are you feeling about that? What are your wishes? Let's get an advance directive. Let's fill out the 5 wishes form so that you can have choice around how you die. Do you want to die at home? Do you want to die at the hospital? Do you want to do every possible thing, or do you want to peace out? Do you want to be on a ventilator and die on a ventilator in the hospital, or do you not? What do you want to tell your kids and your family before you die? What do you want to do before you die? It is one of the gifts of cancer most of the time, is that you have some leeway before you die. When you die of a heart attack, you're fine now, and now you're not. And you have no chance to even call your wife and say, honey, I love you, right? But with cancer, if you're willing to take the gift, there's a lot of gifts. And there's a book called Final Gifts. And also the other one that we enjoy sharing is Being Mortal. Being Mortal is an incredible book that really talks about end of life. And at Cancer Support Community, it's one place you can call up and we can say, have you thought about dying? What's that feel like? What are you afraid of? What are you concerned about? Because if you're a cancer survivor and you look at your loved one in the face and say, I'm afraid to die, which most cancer survivors are, they're going to start crying and you're going to stop talking. But I can sit with that burden. Our staff can sit with that and just sit by your side and be with it. You don't have to stop talking. You can cry a little bit. That's okay. And it's all fine. We can hold that space. But there are a lot of gifts to be had if you're willing to take that time.
That's fantastic. And I think you definitely hit on something, the docs as well, the CT scan shows it's everywhere. And every single person in your life is saying, you're going to fight this chemo, radiation. We're going to Texas. We're going here, there, you're fighting it. And you're sitting there feeling, no, I can't. You're already dealing with a lot. You are already dealing with the biggest load of baggage probably anybody could. And now you have to turn and go against your support. And so who do I even talk to about this? Yeah. And so that's fantastic, because I could see where a lot of people would feel like they just don't have that option to talk. I want to just talk about this objectively with somebody, how I've been feeling. I've been feeling like crap for months. I feel sick. I feel a lot of pain already. That's what got me to the doctor for this diagnosis. So that's really, really cool, Becky. And you're absolutely right. I've always said that at least for the most part with cancer, you get to say goodbye, which is beautiful, which is a beautiful, beautiful thing.
And also it's a time to say, what do you need to do before you die? And, some things I've heard is, I need to get married to the man I'm loving right now. Or another woman, her daughter said, I need to hear wolves howl. And so she wrapped her adult daughter up in her wheelchair and brought her to a wolf center. And they stayed overnight and woke up in the morning and listened to the wolves howl, and then brought her back home and tucked her in bed. And she died peacefully. But she did what she wanted to do before she died, because someone asked her. So
I have goosebumps.
Sometimes
Wow.
it's not that profound. Sometimes
Yeah.
it's just listening to a wolf howl. That's important.
Mm-hmm.
Yeah. And so there's choice. And that's the thing, Cancer Support Community is an empowerment model. So you have cancer and you have choice. You can choose how you manage it. You can choose your treatment. You can choose how you die. You can choose who you talk to. You can choose how you manage it. We empower you to do that. We're not going to tell you what to do. We don't know what you need, right? But we help people have choice. There's no pity around here. And when people understand that they have some choice around the dying process, it changes the whole trajectory.
I could see that. Yeah. And that support, that's huge. So if anybody listening has a neighbor, a friend, a loved one, a family member, anybody, pick up the phone or text or send a Facebook message or something. Hey, check out this place. And
remember that even if you live in a very small town, if you live in Plains, Montana, services are available to you. And everything is free of charge. And we also know how to use the mail. So if you need a wig, we can mail you one. We serve Montana, the entire state. So please reach out. And if you want to be a part of the state coalition, we need all kinds of people to be a part of that. We have changed the trajectory of cancer care in Montana already, and we will continue to do that. We also partner with our American Indian friends who are part of MAWAC. And so we work collectively and side by side. And so there's a lot of opportunity to give back, to be a part of the solution. And if you want to find out more about that, reach out to the Montana Cancer Coalition on your search, and you'll find that as well as the maps.
On behalf of myself and the team that helps to put this podcast together, we want to thank Becky for stopping by and sharing everything she did with these 2 episodes. It was incredibly insightful and informative. If you would like more information on Cancer Support Community Montana, visit our website at talkinghealthinthe406.mt.gov. And if you haven't already, if you could click that subscribe button wherever you download podcasts. Join us again for our next episode, where we'll be back with a new series and a new guest. Until next time, take care.